Hi there, this is Dr. Evan Osar with the Institute for Integrative Health and Fitness Education. Welcome to this edition of Integrative Movement Insider. Thank you so much for joining me on this sunny Sunday. It's actually not so sunny today here in Chicago. It's actually quite cool and rainy. Actually feels a lot like fall as we head into the unofficial start of the fall season this Labor Day weekend. Hope you're having a good weekend, enjoying it, and using it to be productive, because many of you are still in lockdown. Some of you are starting to get back with your clients as health and fitness professionals. So wherever you're at, we wish you well, and I know you're empowering your clients, whether you're seeing them in person live and or if you're training and seeing your clients in the virtual world, which we are doing as well. We're seeing lots of our clients online still, and we're also working with our clients live here, one-on-one in our clinic. So in this series, this is part 4 of a 5-part series on improving balance in your older clients. And again, this is for any client, but especially specifically for your older clients, because some of our older clients have risk factors for falling, and that's the exact topics that we're going to be discussing in our one-day at Fitness Fest this year. Actually, it's coming up in just a few weeks now. I think this weekend is, or maybe Monday, maybe the early bird, so I guess it would be tomorrow. Tomorrow is the early bird registration and enrollment for that conference, and there's tons of great sessions. We are doing a session on female core, shoulder training, as well as this one-day pre-con, and I'm actually doing the keynote presentation on this coming Saturday. But in this series, I'm sharing with you some of the key concepts about improving the lower extremity for improved balance, and simple yet simply effective strategies for improving balance and actually creating instantaneous changes or very quick changes in balance. It doesn't mean that your client doesn't need to work on balance, and these strategies will just work, but it shows you that you can make immediate changes regardless of your client's position and where they are currently in their health and fitness process. So we discussed the impact of the foot and the foot tripod on creating that contact and foundation to the floor. And that's ultimately what sends a lot of proprioceptive signals back to the central nervous system about where the body is in space, as well as allows the nervous system to receive information and send out the appropriate responses back down through the lower extremity. We also talked about the knee and how the knee is a key area of balance. Remember, the knee is a big part of the ground reaction forces. So as hard as your body and foot are hitting the ground, the equal and opposite forces are going through your body. Your knee actually is a very important shock absorber for that process. So we want to make sure that the hip, knee, ankle, and foot is aligned, and a lot of that happens right at the knee. Now we're moving up to the hip, because a lot of our clients have short hamstrings, or those chronically tight hamstrings. Most of these clients, or I should say a good portion of these clients, actually have neurologically shortened hamstrings, meaning the nervous system has overactivated, so to speak, the hamstrings in order usually to provide stability, especially in single leg stance. When the client is walking and they get into single leg stance, a lot of times the client is overusing their hamstrings to support themselves in this phase of the gait cycle. It doesn't mean the hamstrings shouldn't be working regardless, but a lot of our clients are overusing their hamstrings. So what happens is when they stand on single leg, they tend to go into posterior pelvic tilt, or more increased posterior pelvic tilt. Remember that many of our older clients are already stuck in posterior pelvic tilt for one of two reasons. And if you've been following us, you know what those two reasons are. Number one, because they've sat most of their lives. They've sat when they were children, they sat in college or their jobs, and now they sit in retirement way too much. So what happens is that chronically shortens the hamstrings. But the second reason why so many of our older clients, and this almost precedes or overrides the sitting, is spinal stenosis. Remember, spinal stenosis is narrowing. Stenosis is narrowing of any opening. So it's the narrowing of the spinal canal or the neural canal where the nerves are coming out, and that requires the individual to assume a posterior pelvic tilted position, and that's why so many of your older clients, they kind of shuffle along like this. So if we can give them a strategy to get more length in their hamstrings, then they can upright themselves more appropriately over top of their base of support, which is their foot. But a lot of our clients are just stretching themselves right into further flex type postures by stretching like this. They're basically barely stretching at all. They may feel a stretch here, and they think they've done something, but they basically just stretch themselves right back into that flex spine posture. So I want to share with you a very simple assessment. You've seen me do this before if you've been following us. And then a very simple corrective exercise strategy for lengthening the hamstrings and respecting alignment of the thoracolpelvic cylinder and not overstretching the spine. So what we have our clients do is just stand with their feet together, and if your client has a really poor balance, compromised balance when their feet are together, they can always go a little bit further apart. Just make sure you measure the distance between their feet so you can reassess them accurately after you've done your corrective exercise. So put your hands upon your pelvis, rotate to one side, come back to center, always center up, and then rotate to the other side. And actually today I'm doing pretty good, but I can feel a little bit more restriction on my left side because I actually did some good release and good corrective exercises yesterday, so it actually feels pretty good today. So what you want to do is find the more restricted side. So that way you have a before and after assessment to look at your client. So now what we have our clients do usually is lie down, but some of your clients can't get down on the floor. So here's a very simple alternative to that. So we have our clients sit on a bench. Again, we always start with the proper alignment, the most optimal alignment. Align the head and neck and thoracolpelvic cylinder. Hinge to sit onto the bench. And if our clients can't sit in a more neutral position like this, then we'll just elevate them up a little bit because we really want that thoracolpelvic cylinder to be aligned so that way when we hinge, we're actually getting length through the posterior hip and not through the low back. So from here, sitting in neutral upon the sit bones, we're going to bring the one leg out. So the tighter or more restricted hip was the left hip. So I'm going to bring my left leg out. I can bend my right leg, and I'm going to keep that knee relatively straight, dorsiflex the ankle. I'm going to hinge, move my entire thoracolpelvic cylinder over top the hips, the hip joints, the actual femoral heads, and hold that. And already I can feel a tremendous stretch in the backside of my left hip. I'm going to hold this and count for 3 breaths, or hold this for 3 breaths. So it's in through the nose, out through the mouth, or even out through the nose. And the whole time, I'm maintaining that long spine position. I want to make sure that I'm moving the pelvis. It's really the pelvis, but again, it's the entire cylinder rotating over top that femoral head of this left side. So I do 3 breaths and then relax into that position. Now, I'm going to do this 3 times. The second time I do this, I'm going to move the leg into a little bit of adduction. Again, I'm just going to increase the amount of lengthening I get. But again, I'm going to keep the pelvis in the same position. So that way, I'm bringing the leg progressively more towards the midline of the body because most of your clients need more lateral hamstring release. That's why they can't square up their pelvis or level up their pelvis to their forward leg so easily. So again, align that thoracolpelvic cylinder, maintain nice long spine, and then hinge forward. Again, even more of a stretch right now. So again, knee is straight, ankles dorsiflex, hinging the entire thoracolpelvic cylinder over top this hip joint right here, this femoral head. So I'm going to hold that for 3 breaths, maintaining my length. And I also will have the client generally breathe into that same side because usually the side of hip restriction is also the side they don't breathe well into. So again, holding, breathing for 3 times, and then release. Let me do the last repetition from the side here. So again, it's align the head and neck and thoracolpelvic cylinder. Hinge to sit upon the sit bones, bend the non-stretching leg, straighten the other leg, and now I'm going to bring the leg close to midline. So my pelvis is squared up to my forward leg, and now I'm going to hinge forward, and that is a tremendous amount of lengthening here. So if your client isn't feeling this in their hamstring, they're not hinging. So it's important that you get the hinge, the entire thoracolpelvic cylinder hinges over that femoral head and stay square up to that leg that you're stretching. Breathing 3 times, maintaining that alignment of the rib cage over top the pelvis, maintaining that little bit of dorsiflexion of the ankle. And if that's too intense, just relax that dorsiflexion. And just keep the ankle a little more plantar flex. Again, that's a little easier. And then as I bring it into dorsiflexion, I bring myself up and over top this hip joint right here. And now, tremendous stretch, maintaining that alignment, 3 breaths, and then release. Now, let's stand up. Let's see if we made any difference. So again, left side was the tighter of the 2 sides. Feet together, rotate, come back to center, and that feels actually way easier now. So just the range hasn't increased dramatically, but the ease of motion has dramatically increased. And that's why for a lot of your clients, it's actually not muscular tightness. It's actually neurological tightness, or I should say neurologically driven tightness. And that's why they're getting contractures. That's why they're getting so much gripping, because they're neurologically upregulating those muscles, and that's why they're losing range of motion. So now I have more range of motion, and now it feels a lot better. Like my leg just feels lighter now. So I want you to try this on yourself. Do your self-assessment, then do your release like we just did. But now you also have to use this muscle because you just released it. Your nervous system doesn't know what to do with this range of motion unless you teach it a different pattern. So one of the patterns we love to do, you know the pattern we love, is the split stance hip hinge. Now, we teach this pattern to everyone in our certification courses, all from the foundational levels of integrative movement specialists all the way up to the most advanced certified individuals. I even taught this in my motor control class for Rocky Mountain University of Health Sciences. I taught my master students this same pattern. It was shocking to me. I shouldn't say shocking to me, because it took me a long time to master this pattern. And this is one of the most challenging patterns to do well and do optimally. However, when you do it optimally, it can make all the difference. And here's really how it goes. Because you have to teach the client to eccentrically load that posterior hip complex, the hamstring, the glutes, as well as those external hip rotators. So again, it's all about aligning the head and neck and thoracopelvic cylinder, hands upon the pelvis, step back, maintaining that square pelvis to that forward leg. Breathe in, breathe out, and then breathe in to come back up. Breathe in, breathe out, trying to maintain the pelvis as much as you can over top the ankle joint of the forward leg. So a lot of our clients, they're like this. They're on their back leg, and they're like, oh yeah, I just feel this in my back. Because they're bending from their back, they're not hinging from their hips, or what they're also doing is they're doing this. They're shoving their pelvis back versus getting pure rotation of that pelvis. And if you're doing this right, you should feel it right back here and right through the hamstrings. If you're not doing it right, well, you will feel it in your low back, or you'll feel nothing, like, I don't feel anything happening, because you're not aligning the TPC, and your client is not aligning over top their forward leg. From behind, again, it's so important to make sure you look at the belt line of your client, and they put their hands on their pelvis so they feel that pure rotation, and you see the belt line stay level. Because what you'll see your client do is you'll see that opposite side start to come up like that, because they're externally rotating this hip. They're not staying squared up and internally rotated. So again, long spine, stack that thoracopelvic cylinder, maintain the weight on the stationary leg, step back, maintain 80 to 90% of the weight on the forward leg, breathe in, breathe out, hinge, and again, tremendous stretch in this side. Remember, the key to lower extremity function is really about aligning that hip, knee, ankle, and foot complex, and then eccentrically loading. And that's what we're doing right here. That's the key to weak glutes. That's the key to balance issues. That's the key to clients that have knee problems when they squat and or lunge. They're not getting enough anterior pelvic rotation. They're not getting that eccentric lengthening. So this whole little corrective exercise strategy is designed to do exactly that. Align the thoracopelvic cylinder, align the hip, knee, ankle, and foot, get the foot tripod set, and then eccentrically load that posterior hip complex so that your client can get better activation of the glute, hamstring, and external hip rotators, so that they can actually get anterior pelvic rotation to unload their knees, to take the stress off their back, and to load up their posterior chain as they should be doing. So let me check my range of motion one more time. Hands on the pelvis, rotate right. That still feels good, actually feels a little bit better. Rotate left, still feels really good, really free, and it feels actually quite awesome. If I check my single leg balance, it's good on that side, and usually I struggle on that side, and that wasn't actually so good. So right side, easy, no problem. Left side, again, no problem. Again, this is generally, my left side is generally my more problematic side. So again, very super simple corrective exercise strategy to improve range of motion, improve balance, and help your clients progress towards doing the things they need to, want to, and love to do. This is Dr. Evan Osar. If you have any questions about the process we're taking you through, because what we're sharing with you here is the integrative movement system, the proprietary process we created and use with our own clients here in our clinic, that we use on ourselves and that we teach in our most advanced certifications, the Integrative Movement Specialist certification. We're going to share the integrative movement system with you in full in our one-day pre-con at Fitness Fest. I'm going to put the link next to this video. Actually, Mary will put the link next to this video. And again, if you have any questions about this process, about things that you're using with your clients, feel free to leave them. I will answer them. Any question except for what's wrong with me, because I've not done a thorough history and or assessment on you to know what's wrong with you. But if you have any questions about the concepts and or strategy that I shared with you here or in any of this series, please reach out, let us know. And again, thank you for all you do for your clients, for your community, for being that leader. Because again, you know, you live in this world today. You know it's challenging with COVID, with the social unrest, and all the challenges we're experiencing as health health and fitness professionals, as business owners, as family members. Our clients need us to step up. Our family members need us to step up. We need to put aside our sort of theory on what's going on in the world and our beliefs and use this as a social platform and use it as a platform for leadership, for bringing people together rather than creating divide. So thank you again for all you do, and if there's anything we can do to help support you in your role as a leader, please reach out. Let us know. This is Dr. Evan Osar. Thanks for watching. Thanks for being part of our community. Make it a great day. We'll talk to you soon. Bye-bye.